Today we are going to be showing you how to treat a face burn. Sarah here came into the ED and she has a burn on her cheek and on her forehead, going into her hairline a little bit, and on her nose. Okay, so first thing you're going to want to do is you're going to want to, if your patient's comfortable enough, we're going to get a basin, washcloths, and then we just use bar soap for the face. Once you have your washcloths, you're going to want to debride and clean the face. You're going to want to try to get any dead skin off of there, any soot, anything like that, as much as the patient can tolerate. Once the face is all clean and debrided, if it's a male patient, you're going to want to shave. Make sure they're as clean shaven as you possibly can. We suggest that they shave at home twice a day, in the morning and at night, because any hair in there can just harbor bacteria in the wound, which obviously we don't want. As well as if, let's say Sarah is burned up here and it's going into her hairline, you're going to want to make sure you pull back the hair, and a lot of times the burn will go into the hairline and it doesn't look like it at first, but you're going to have to shave back to make sure that that wound is open so that we can be covering it with dressings. Once that the patient is all clean and debrided and ready for dressings, you're going to get your sterile field out. We got sterile fields. We have fine mesh gauze. This is Vaseline, but we're pretending it's bacitracin. Bacitracin is basically just like a triple antibiotic ointment, kind of like Neosporin. We got scissors, and then we have band net. You're going to want to use size 9 or 10 for the face typically, and then we have our sterile gloves. Before we don our sterile gloves, you're going to want to take, bacitracin comes in a tube just like this. You're going to want to open the tube up, and I like to squirt it all over the fine mesh before I get sterile. And then once you're sterile, we'll distribute it all over the mesh. Perfect. All right. Now you're going to take your sterile gloves. And once you have your sterile gloves on, we're going to distribute that bacitracin all over our gauze. Now you want it thick enough, obviously, that you're actually like treating the wound with bacitracin, but you want it thin enough that it's going to kind of adhere and cast to the wound a little bit, because when they take it off to do face care the next time, it's going to debride that wound for us, and that's less scrubbing that you're going to have to do. All right, so once your gauze is all ready, I'm just going to take it off your sterile field, and then I think the easiest way, the way I prefer to do it, is to just cut large rectangles and to take them to the wound, kind of figure that out, and apply the dressing. Perfect. And then we're going to need a small strip over the nose. And the pieces don't have to be perfect, just as long as they're covering the wound and they're overlapping the wound just enough that if they move around, they'll still do their job. Perfect. And then we got a little piece on the forehead. Make sure all their hair is out of there. And people make sure it's out of their eyes and everything, because people do have to live with this on their face, so you want to try to make sure there's not little stragglers in there. Make it as comfortable as possible. Perfect. Okay, so now once you have all of your gauze on, you're going to want to take your band net and stretch it out a little bit, because it doesn't need to be super tight. We're really just trying to make sure everything sticks to the face. Put it over the face. I like to pull it in on the back of the head. If you have another person, it'll be a lot easier. But if you're on your own, and then kind of just set it over their face like so. And then once you got it on their face, you're going to want to make eye holes. If their ears are burnt, you're not going to want to make ear holes. But if they aren't, you can obviously cut holes, and then you'll cut holes for the mouth. Kind of just use your own discretion, and then whatever else you need. So that is face care.